Okay, we're just getting started on the right knee. We're looking in the medial compartment first. This is the anterior portion of the medial compartment. The anterior meniscus looks great. You can see a lot of vascularity in the joint lining or the joint capsule here, the redness. I'm going to go ahead and rotate the camera around so we can look more towards the back. And so now we'll get a better look at the posterior horn of the medial meniscus. And actually, so far, so good. There might be a little bit of a wrinkle in the back. We'll show you some more in a little bit. The articular surfaces actually look like they're in pretty good shape here. Okay, so this is your anterior cruciate ligament. It looks okay. It's a little bit frayed here. And you can see how you've got this bone almost sitting right on top of it here. So we'll get a little burr. We can take care of that so it doesn't rub on your ACL. And those are just remnants of the ligamentum, and that looks fine. So while they're getting that organized, we'll look in the lateral compartment here. This is the anterior horn, and then we'll go into another position called figure 4. And now we can see a little bit back. Go ahead and hold on. Pull this out. Okay, so we've just been doing a little limited partial meniscectomy of the lateral meniscus. I don't see anything grossly unstable that needs a repair. And I think we're actually almost just about done here. There's a little bit more chondrosis in this lateral compartment compared to the medial, but not too bad. And I think our bone marrow injection will help with that. We'll just make sure that this meniscus is smoothed out. Push down on the, or technically grade 4, which is the highest grade. Okay, we're looking at your patella, and there's some areas where you've lost all the cartilage behind the kneecap. You can see here, there's one of them. It's a little bit better over here laterally, but more in the central part of the patella, you've got these areas where the cartilage is unstable. That's why we're doing that stem cell or bone marrow concentrate injection today. Okay, so that's a pretty good look of what happens when you start to lose cartilage and you get down to the bone. The trochlea, which is the groove the patella slides in, also has some loss of cartilage. I didn't see any areas that are full thickness, although we're getting really close right in here. Okay. But I think that's it. So we're going to go ahead and have one more look around. If there's anything else interesting, we'll show you. But otherwise, we're going to do our stem cell injection after we take all the fluid out of the knee. And hopefully this will do the trick in getting you better. So good luck to you now. Bye-bye. Okay, so here's our final picture of the patellofemoral joint. At the top of the screen is the patella. You can see that central area of cartilage loss. And then some corresponding areas in the trochlea as we look all the way down the front where this cartilage is also getting a little bit frayed. So we're going to finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.